Sathyabama Institute of Science and Technology.
A very good morning. I am Dr. Deepa, Assistant Professor, College of Physiotherapy, Sathyabama Institute of Science and Technology, deemed to be university. In this lecture video, let us see what is aquatic exercise. Aquatic exercise refers to the use of multi-depth dimensional pools or tanks that facilitate the application of various established interventions. Those are stretching, strengthening, joint mobilization, balance and gait training and endurance training. The specific purpose of aquatic exercise is to facilitate the functional activities by providing an apt environment for the patient and the practitioner to enhance their therapeutic interventions. The goals and indications. When we need to facilitate the range of movement exercise, initiate resistance training, facilitate weight bearing activities, enhance delivery of manual techniques, provide three-dimensional access to the patient, facilitate cardiovascular exercise, initiate functional activity replication, minimize the injury or re-injury during the rehabilitation, enhance patient relaxation. Precautions. Patients who are having fear of water, neurological disorder, seizures, cardiac dysfunction, small open wounds. Any incidences that are happening inside the pool, immediate evacuation with proper cleaning is being suggested. Contraindication. The incipient having cardiac failure or angina, unstable angina, respiratory dysfunction with a vital capacity of less than 1 liter, peripheral vascular diseases, danger of bleeding or hemorrhage, severe kidney disease, open wounds, skin infections like tinea pedis, uncontrolled bowel or bladder movement, water and airborne infections such as influenza, and then gastrointestinal infections like typhoid, cholera and poliomyelitis. Uncontrolled seizures where safety issue is being carried out for the therapist as well as the patient and immediate evacuation is being recommended. Now, in the earlier days, such kind of Hubbard tank were be used for a full immersion techniques. You can see in the picture. The pool dimensions, there are standardized pool dimensions which has to be followed for an individual person's space occupied and for the exercises to be performed. The pool has to be maintained in such dimensions where there is an immersion of partial hip level to the xiphoid process level and the neck level to do a particular level of activities. Strength training, aerobic training exercises can all be performed. Certain precautions and safety measures have to be performed, have to be carried out in the pool and around the pool like railings, ramp, staircase. All these things should be non-slippery. There should be non-slippery mats being provided so that the patient do not fall down with any falls. Properties of water: buoyancy, hydrostatic pressure, viscosity and surface tension. Now let us see the first properties of water as buoyancy. Buoyancy is the upward force that works opposite to the gravity. Now the principle which is followed by is the Archimedes principle, which states that immersed body experiences an upward thrust equal to the volume of the liquid displaced. The clinical significance is relatively there is weightlessness and joint unloading occurs and a three-dimensional effect can also be given to the patient. Now this is the buoyant force. You can see the black color spots showing the buoyant force which is acting against the center of gravity. The buoyant force can be used as assistance as well as the resistance for the patient to perform his exercises. The percentage of weight bearing at various immersion levels, that is at the ASIS level, xiphoid level and C7 level. At the ASIS level, 50% of the body weight is borne by the lower extremity. At the xiphoid level, 30% of the body weight is borne, and at the C7 level, 10% of the body weight has been borne. The hydrostatic pressure. Definition: hydrostatic pressure is the pressure exerted on the objects on all the sides. The principle that is followed is the Pascal's law. It states that the pressure exerted by the fluid on the immersed object is equal on all surfaces of the object. As the density of the water and the depth of the immersion is been increasing, the hydrostatic pressure also increases. Clinical significance: reduces the limit effusion and assists venous return, induces bradycardia and centralizes peripheral blood flow. Viscosity: Viscosity is a friction between the molecules of the liquid resulting in resistance to the flow. So the principle is resistance from viscosity is proportional to the velocity of movement through the liquid. The clinical significance: water's viscosity creates resistance with all active movement. A shorter level will cause increased resistance. So if a person is immersed and his lower limb is immersed, at the proximal level of the limb, if you provide a resistance, there is more of effort to be done to complete the work. Surface tension. The surface of the fluid acts as a membrane under the tension. Surface tension is measured as force per unit length. The principle: attraction of the surface molecule is parallel to the surface. The resistance of the force of surface tension changes proportionally to the size of the moving objects throughout the fluid surface. So the clinical significance is an extremity that moves through the surface performs more work than kept it under rest. Hydromechanics. Definition: hydromechanics comprises of physical property and characteristics of fluid in motion, that is the laminar motion, turbulent motion and the drag. Laminar movement, the molecules, they follow a parallel pathway and it is slow in nature. A turbulent, which does not flow into a parallel pathway, which is very fast. A drag is a cumulative effect of turbulence and fluid viscosity acting on an object in the motion. The clinical significance of a drag is movement through water increases, resistance to the motion increases. Application of an equipment inside the pool like a paddle or a boot increases the drag and the resistance also is offered to work done. Now this is a diagram for a laminar flow which is parallel and slow, which is turbulent, not parallel and very fast. Thermodynamics. There are two types things in that is specific heat and the temperature transfer. A specific heat is the amount of heat that is required to raise the temperature of 1 gram of substance by 1 degree. The property are the rate of temperature is dependent on the mass and the specific heat of the object. Clinical significance is water retains heat 1000 times more than air. Difference of water temperature and immersed object temperature equates to the minimum change. What is the temperature transfer? Water conducts temperature 25 times faster than air. Heat transfer increases in velocity. A patient moving through the water loses body temperature faster than the immersed patient who is at rest. Center of buoyancy. The center of buoyancy is the reference point of immersion object on which the buoyant forces of fluid predictably act. Now you can see the red spot is the center of buoyancy in both the picture and the blue spot is the center of gravity. So with the change of the buoyancy, the body floats on the water. Vertical position, the human center is exactly at the sternum. In the vertical position, posteriorly placed buoyancy will cause the patient to lean forward and anteriorly placed buoyancy will make the patient lean backward. Patient with a unilateral leg extremity amputation leans towards the residual limb when immersed in the pool. The water temperature. Patients are unable to maintain their core temperature at temperatures below 25 degrees Celsius. So exercises at a temperature more than 37 degrees are hazardous. So if prolonged maintenance at higher intensity, they will have increased cardiovascular demands with the rest and exercise. A waist deep water exercise at 37 degrees Celsius, the thermal stimulus to increase the heart rate overcomes the centralization of the peripheral blood flow due to hydrostatic pressure. Aquatic exercises, especially the flexibility and strengthening, gait exercises, relaxation can be performed aptly in the 26 degrees Celsius and 33 degrees Celsius. Therapeutic exercise performed in warm water of about 33 degrees Celsius may be beneficial for the patient with severe musculoskeletal injuries, osteoarthritis and rheumatoid arthritis. Cardiovascular training and aerobic exercise training should be taken at 26 degrees Celsius and 28 degrees Celsius. Now let us see what are the equipments for the aquatic therapy. There are pictures which have been identified: the float rings, cervical collar, buoyancy belt, swim bars are all used to assist the patient in the water, remove their fear and provide a comfortable effect. These are the hydrotone boots and belts, hand paddles and the kickboards. These hydrotone boots and belts will help in the drag effect of the water. So as we have come to the end, let me summarize the aquatic exercise. We have seen what is an aquatic exercise. Furthermore, we saw the properties of the water, how we are using it for an exercise, and what are the equipments that are being used for an aquatic exercise, how to enhance the cardiovascular and pulmonary responses with the help of aquatic exercise. Thank you.